everyone, welcome back to the channel. Hello there, my name is Patricia. In today's video, I'm going to explain Medicare in simple terms for you to understand. We're going to go over the parts of Medicare, and I'm going to help you decide whether you want to go with a Medicare Supplement plan or a Medicare Advantage. So if you're interested, keep watching this video. Like I said, my name is Patricia. I am a registered nurse and a health insurance agency owner. Here we help our clients understand Medicare, their options. We also help clients get enrolled into Obamacare, also known as the Marketplace Health Insurance, and the Affordable Care Act. If you need any help, any assistance, our services are 100% free. We'll be more than happy to assist. So first, what is Medicare? So Medicare is health insurance for individuals 65 and older, or you could qualify and get Medicare through a disability. So let's talk about getting Medicare for age 65 and older. So if you worked in the U.S. and worked 40 quarters, which is 10 years, and you paid your Medicare taxes, then you qualify for Medicare when you turn 65. So you have a 7-month period to go ahead and enroll in Medicare. So you have 3 months before you turn 65. You have the month of your birthday that you turn 65, and you have 3 months after you turn 65 to enroll in Medicare on time. Now let's talk about getting Medicare through a disability. There's 2 disabilities where you would get Medicare automatically. So that would be end-stage renal disease and ALS. If you have those 2 diseases, then you could get Medicare automatically. Now let's talk about other diseases that qualify you for Medicare. So if you receive SSDI disability, so SSDI disability, not SSI, but SSDI, then you would get Medicare automatically after 24 months of your disability. Okay, so those are the 2 ways to get Medicare. Getting Medicare because you work here in the US and having a disability. Now let's talk about the parts of Medicare. Before we talk about Medicare, let's talk about how much Medicare will actually pay. Medicare does not cover you at 100%. Medicare would pay 80%, leave you behind 20%. And this is what we want to protect you from, that 20%, because it could be 20% of anything. There is no cap. It could be 20% of a $100,000 hospital bill, a $100,000 hospital bill. It does not matter. There's no cap. So you're responsible for 20%. But there are 2 ways to help you with that 20%. And we'll talk about that later on in the video. And that would be a Medicare Supplement or a Medicare Advantage. But first, let's talk about the parts of Medicare. All right, so we're going to start with Medicare Part A. So Medicare Part A is your hospital coverage, okay? So what is the cost of Medicare Part A? The cost is actually $0 a month if you pay Medicare taxes, like we said before. So if you paid your 40 quarters, you paid your taxes when you was working, this is why you was paying the Medicare taxes. You was actually paying for Medicare Part A. So Medicare Part A is $0. Let's talk about what does Medicare Part A actually covers. Like I said, it is your hospital coverage. It also covers skilled nursing care. Not to confuse this with long-term care, because Medicare does not cover long-term care. It covers skilled nursing care. So say for an example, you was out in the yard, you fractured your hip, and you had to have surgery. After surgery, most likely the doctor would send you to a skilled nursing facility where you could get therapy, which is skilled nursing care, okay? You may get things like IV treatments and nursing care and wound care and things like that. that is covered under skilled nursing care. Part A also covers home health services and hospice as well. So let's talk about Medicare Part B. So Medicare Part B is your medical coverage. So think of things that you get done outside of the hospital. So Medicare Part B is going to cover your doctor visits. It's going to cover outpatient services such as mental health. It's also going to cover blood work, x-rays, medications that you take inside of the doctor's office like an injection or such. Also going to cover medical equipment, ambulance services, clinical research. Also going to cover home health as well. So just remember, Medicare Part B is going to cover medical, like going to the doctor and all of the other things that I have listed. Now let's talk about the cost of Medicare Part B. Now, Medicare Part B is going to depend on how much money you made in the past 2 years. So it's going to go by a chart called the IRMA chart. Now, this chart is going to tell you how much you're going to pay for Medicare Part B. And I will put the chart right here on the screen for you so that way you can see it. But most individuals will pay $170.70 in 2024. The Part B premium does change every year. So that's your Medicare Part B. Medicare Part B is very important to have because some people think if they just have Part A, you're fine. You also need Part B to see the doctor and such. So it's very important to have Medicare Part A and Medicare Part B. Because Medicare Part B does have a monthly premium, you can decide to delay Medicare Part B when you turn 65. Now, you want to delay Medicare Part B only if you fall under this category. Okay, so you would delay Medicare Part B if you're still working and you are getting employer health insurance coverage. This employer health insurance coverage must be considered as credible coverage, and HR should be able to tell you if you have credible coverage. Most employer coverage would be credible coverage, and it has to be 20 or more employees at your job. So 20 or more employees, and you have to be receiving credible health insurance coverage. You can keep your insurance at your job and delay Medicare Part B. Now, when you're ready to retire, it's very important to go ahead and enroll in Medicare Part B. If you do not enroll in Medicare Part B on time, you will be hit with a late Part B penalty. You don't want that because that follows you for the rest of your life. And unfortunately, you do have this penalty every single month. So please, please, please enroll in Medicare Part B on time. Now, what if you have VA coverage, Tricare for life, and you see doctors within the VA system? I highly, highly recommend that you still enroll in Medicare Part A and Medicare Part B. Why? Why, Patricia? Why should I enroll in Part B when I have VA coverage? Because you have more options. You can see doctors within the VA and you can see doctors outside of the VA. I highly recommend that you get enrolled in Part A and B. I've seen so many clients that wish they had Medicare Part B and they are a veteran. Of course, it's your choice, but in my experience, I highly recommend that you do enroll in Medicare Part A and B so that way you do have more options to see doctors outside of the VA. Now that we have talked about Medicare Part A, Medicare Part B, let's talk about that 20% that Medicare leaves behind. So how we're going to bridge the gap and help you take care of that 20%. So you have two options. You could go on a Medicare Supplement plan, and the Medicare Supplement plan will pay the 20%, or you could go on a Medicare Advantage plan. Now, the Medicare Advantage works a little different. You're going to have copays. So let's talk about these two options. Medicare Supplement. Some individuals call this the Cadillac of Medicare. Why? Because with a Medicare Supplement, you can go to any doctor that takes original Medicare. So if your doctor takes original Medicare, it will take the supplement because the supplement and original Medicare works hand to hand. So Medicare will pay the 80%. The supplement will come along and pay the 20%, give you 100% of coverage. Now, let's talk about the pros of the Medicare Supplement. We already talked about one, which is you could go to any doctor that takes original Medicare. You can also travel with this plan as well. Say you want to be in New York for 6 months and Florida in the other 6 months. Well, you could travel with this plan. There's no doctor network, okay? So you don't have to worry about, hey, do you take my supplement? No, the question is, do you take original Medicare? If the doctors say yes, then they take the supplement. So no doctor networks to worry about, which is really nice. You also don't have to worry about pre-authorization. Pre-authorization is when sometimes the insurance carrier may say no to a treatment. You have to go through authorization. You have to go through approval with the insurance carrier. So that's nice when it comes to a Medicare Supplement. If it's a service that original Medicare covers, then the supplement will follow and cover that service as well. So that is a great thing about a Medicare Supplement. There are two main common Medicare Supplement plans that are out there right now, and that is Plan G and Plan N. With Plan G, all you have to do is pay your annual deductible of $240 a year. Once you meet that deductible, then the plan will kick in and pay the 20%. No copays whatsoever with a Medicare Supplement. You do have a monthly premium, however, some individuals love the idea of a supplement, but they simply cannot afford it. Especially here in Florida, our supplements are a little higher, unfortunately. A Medicare Supplement will cost about $190 a month for a Medicare Supplement. Could be a little less or a little more when it comes to a supplement plan in Florida. So you're paying your Part B premium of $170.70 in 2024. You're also going to pay your Medicare Supplement of, say, $190. So that could add up for some seniors that is on a strict budget. Other parts in the country, a supplement may cost you $100. So it's more affordable in certain areas. So like I said, supplements are considered the Cadillac of Medicare because you can go to any doctor that takes original Medicare. Now let's talk about another supplement that is popular as well. And this is going to be Supplement Plan N, okay? With a Supplement Plan N, you do have some copays. So you're going to pay up to $20 for a doctor visit and up to $50 for a ER visit. Now your Medicare Supplement Plan N is going to cost you a lot cheaper than a Plan G because you do have some copays. You still have to pay your $240 deductible, and like I said, you pay your copays, and the Supplement Plan N will do the rest when it comes to your medical bills. Now, when it comes to deciding what company you want to get your Plan G or Plan N from, because these are given by insurance carriers, right? So when you decide, hey, I want a Medicare Supplement Plan G from this carrier versus that carrier, the very most important thing to look at, not the monthly price of the actual supplement, because all of the supplements have to do the exact same thing as far as billing. They're going to all do the same thing. They're going to cover that 20%. The most important thing is to get a supplement plan that does not jack up their rates after you enroll, okay? Because this is the thing about a Medicare supplement. When you turn 65, there are no health questions. No health questions whatsoever. That is the best time to get on a supplement when you turn 65. Because down the line, if you get dementia or you get Parkinson's or whatever the case may be, and you can't answer the health questions, then you won't be able to get on a supplement plan because of underwriting, okay? So like I said, when you first turn 65, there's no health questions, so that's the best time to get on a Medicare supplement plan. Let's go back. I kind of jumped around a little bit. Let's go back when I was talking about comparing different companies with a Medicare supplement. All of the supplements do the same. The only difference is going to be this company may cost $50 more, or this company may cost $20 less, or whatever the case may be, right? The only difference is the monthly premium, right? Like I said, they all do the same thing. You want to get with a company that is strong in the market. They're not going to, start you out at a very low rate, and then 5 years you're on the plan, the price skyrockets and you can't afford it anymore, and so you have a health problem, so you can't get on another plan because of underwriting. So you want to work with a broker that knows the plans in the area and can compare the rate increases. We can only go by the history of that insurance carrier, how well they're in the market, the history of their plan increases, and how stable they are in the market in the past 10, 20 years or so. So you have to be careful. You don't want to just go with the lowest rate because they may jack up the rate and you can't afford it anymore. So you have to be very careful not getting on the supplement plan just for the price. So my take on a Medicare supplement plan is if you can afford it, then definitely go for it. Some seniors, unfortunately, simply cannot afford it. But if you can afford it, it is a great option when it comes to covering that 20% that Medicare leaves behind. Now let's talk about the Medicare Advantage plans. So with the Medicare Advantage plans, these plans are highly advertised. You see these everywhere on social media. You see them on your TV commercial. Every single where they're talking about Medicare Advantage. Medicare Advantage plans will come with additional benefits like dental, vision, hearing. Like I said, it works totally different than a Medicare supplement. With a Medicare Advantage plan, you're going to have copays, right? So let's talk about some examples of some copays. So your primary care doctor may be $0. To see a specialist, you may pay a $20 copay. To go into the hospital, you may pay $150 a day for days 1 through 5. ER visit may be $100. So you see what I'm saying? It depends on how often you use the plan. We call these pay as you go. When you use the plan, you pay copays. If you don't use the plan, then you don't have any copays. Most likely, these plans are going to be $0 a month. If not, the premium are usually very little, like $20, $30 a month for a Medicare Advantage plan, but usually the plans are $0 a month. Like I said, you pay copays as well. You're still gonna pay your Part B premium. Here's a fun fact. Medicare Advantage plans are also known as Medicare Part C. So if you have Medicare Advantage, you already have Medicare Part C. Some people think it's something different or they're missing something. No, it's actually the same thing. Now, there are plans out there that's called a give back. What's a give back, Patricia? A give back plan is when they will actually give back so much money back into your Social Security check. So say you have a give back plan of $150. So your Part B premium is $174.70. So you're going to pay that minus the $150. So you're paying less than $20 for your Part B premium. So that's how the give back plans work. Now you do want to compare give backs with regular plans because usually the give back plans copays may be a little higher. Some individuals are fine with the give back because they don't go to the doctor that often, they're pretty healthy, so they'll take a give back plan and that works for them. So let's talk about the pro of a Medicare Advantage. I would definitely say a Medicare Advantage pro would be more cost efficient, okay? You're going to pay lower for your monthly premium as far as the plan itself. Usually, like I said, $0, and you just pay as you go, okay? So it's more cost efficient. Now, let's talk about the cons. So the cons is going to be, you do have to stay within doctor networks, okay? You can't just go to any doctor. So there's two types of plans. You have your HMO plans. When you have an HMO, you do need a referral to see a specialist, and you have to stay within network. There also are PPO plans where you have more options if you see doctors outside of the network. If the doctor takes the PPO, they still have to say, I will take the PPO. Then you may pay more if you see doctors outside of the network, okay? And you don't need a referral for a PPO plan. I will also say a pro is the extra benefits. Dental, vision, hearing, that's definitely a pro. Another con is that you may need pre-authorization to get a certain treatment done. The insurance carrier may say no on certain things. So that could be a con because, of course, people just want to get things done. They don't want to have to go through pre-authorization. But Medicare Advantage plans can be a great option, especially if you're on a fixed income. Another thing about a Medicare Advantage plan for lower income individuals is that you can get extra things like healthy foods, or get assistance to pay your utility bill or your phone bill, or Uber rides, transportation, silver sneakers, which is going to the gym. So there can be some perks, a lot of perks for low-income seniors. Get on these particular plans where you can get healthy foods or get help with pest control or pet supplies or things like that. You do have to be dual eligible. What is dual eligible? This is for someone that has both Medicare and Medicaid. With these two together, it makes these plans really, really attractive. And the reason why they have these extra health benefits, so that way it can help you stay healthy. A lot of seniors love this extra benefit. You can go to the grocery store and get you some vegetables, meats, and make a nice cooked meal with your healthy foods plan. So that is great when it comes to some of these Medicare Advantage plans. Some of them do comes with a lot of perks. Now, of course, it does depend on your area, your zip code, where you live, depending on the plans that is offered in your particular area and how much of a healthy food benefit or rent assistance or utility assistance that you can actually receive. So yeah, so let's talk about Medicare Part D. So Medicare Part D is your drug coverage. So Medicare Part D is going to be prescriptions that is prescribed by your doctor that you take at home. So this will cover your medication costs, okay? So if you're getting a medication at your doctor's office, say a injection or a infusion or something like that, that would be covered under Medicare Part B. So like I said, Medicare Part D is the medications taken at home. So if you choose that you want to go on a Medicare Supplement plan, you will need a standalone Medicare Part D plan. How do we help our clients choose a Medicare Part D plan? We will look at their medications, we would do a search, and we will let them know what Part D plan will cover their medications the best. So if you're on Tier 1 medications, generic medications, then usually your medications would be $0 copay. If you're on other tiers, then you may have a $5 copay or a $30. It just depends on the plan, but you will have copays depending on what medications that you take. Now, if you're on a supplement, of course, you're going to also have to pay your Part D premium. Depending on where you're located in the USA, your Part D premium could be about $8, $10 a month. It could even go up to $100 and more per month, okay? So if you're on a supplement plan, you got to remember you're going to have the Part B premium, you're going to have your supplement premium, and you're going to have your Part D premium as well. All right, let's talk about if you on a Medicare Advantage plan. If you're on a Medicare Advantage plan, then your Part D will be included in your plan. Remember when I talk about Medicare Advantage plan, usually have these extra perks. So that's one of the extra perks, that your Part D will be included in your Medicare Advantage plan. And we do the same thing when it comes to Medicare Advantage. If our clients say, you know what, I want a Medicare Advantage, then we'll look at their doctors, of course, because we want to make sure that their doctors take this Medicare Advantage plan. We're going to look at the medications that you take as well, and then we're going to compare a few plans and let you decide based on the doctors and the cost of your medications and such. So earlier we talked about avoiding the late Part B penalty by simply enrolling on time. Part D also have a late penalty as well. So you don't want to say, oh, I don't take any medications, I don't need Part D. Well, when you do need Part D and you decide to enroll in Part D, now you have a late Part D penalty. So it's best to just enroll on time. When you get on your Part A, you get on your Medicare Supplement, just go ahead and enroll in Part D as well to avoid any penalties. And of course, if you have a Medicare Advantage plan, we already said the Part D will be included. Now, there are some Medicare Advantage plans designed for individuals, say, are veterans and they're getting their medications through the VA, and you can get on a plan where Part D is not included. So make sure you work with a broker that you trust that will put you on a plan with all of the right parts, so you don't have any issues with any penalties at all. Alrighty, so that is the end of today's video. I hope I made it super clear on the Medicare Parts, and I also hope that I helped you decide if you want to go on a Medicare Supplement or a Medicare Advantage plan. If you have any questions, concerns, leave them in the comments below, and we'll be more than happy to answer your questions. If you need any help, give our office a call. We'll be more than happy to help. I'll leave the number right here. Thank you so much for watching, and I'll see you on the next video. Please like this video, comment, subscribe, and I'll see you pretty soon. Thank you so much for watching. Bye.